couple of recent videos on social media circulating about situations like this and talking about postpartum rage. So let's just discuss postpartum rage because it is a real thing and it's something that's not really talked about in a productive manner. Now, postpartum rage is technically defined as an emotional state that can occur in individuals after giving birth. It involves intense anger and is accompanied by aggressive verbal and physical behaviors. And inevitably, this rage is going to lead to a multitude of various negative emotions, such as fear, disappointment, and of course, anxiety. People who have postpartum rage also can have a lot of other symptoms like insomnia, depression, delusions, sudden crying, stress, loneliness, and an inability to overall regulate their emotions. And because this individual is postpartum and has a new baby and knows how they're supposed to be feeling when they have these episodes of postpartum rage, they can feel very guilty. And it is very difficult for someone experiencing this to not blame themselves or to try to understand what's going on or to even talk to somebody about what's going on due to fear of shame and also embarrassment. Now, an overwhelming majority of data or research on postpartum or perinatal mood and anxiety disorders centers around postpartum depression. Very little surrounds or explores postpartum anger or rage. Despite the fact that there's little research on this and little being talked about, postpartum rage is not uncommon. Having feelings of postpartum anger is not uncommon. It's just not talked about. Now, this postpartum rage can occur up to 12 months postpartum, but in the data that we do have, it typically peaks at around 6 to 8 weeks postpartum. And individuals who experience postpartum rage can have rapid mood swings, deep loneliness, depression, sense of hopelessness, and then this can ultimately lead to thoughts of self-harm or harming their newborn. Now, what can be done? There's several things that can be done, but the important thing is to do something. Rage rooms, physical exercise, therapy and counseling, and even throwing ice. Throwing ice can even help with postpartum rage. The most important thing is to acknowledge that it's happening, understand that it's not your fault, and that things can be done. Things need to be done to keep both you and that baby safe.